We now continue with our mini lecture series on the skeletal system with the appendicular skeleton. Topic 1.3, Part B, the pelvic girdle and the lower limb. The learning outcomes for this mini lecture on the pelvic girdle and the lower limb in the appendicular skeleton include to be able to describe the composition of the pelvic girdle and its attachment to the axial skeleton. Identify structural features of the coxal bones. Identify structural features of the femur. Identify structural features of the tibia. Identify structural features of the fibula. Identify the key tarsal bones of the foot. And identify the phalanges of the foot. The pelvic girdle attaches the lower limbs to the axial skeleton and transmits all the weight from the upper body to the lower limbs. The pelvic girdle consists of the two hip bones and the sacrum, together forming a ring, or the girdle, around the lower torso. The two hip bones, or the os coxae, are made up of three bones that are fused during late fetal development and childhood. The three fused bones are the ilium, the ischium, and the pubis. The sacroiliac joint provides the attachment of the pelvic girdle to the axial skeleton, where the sacrum meets the ilium of the coxal bones. Anteriorly, the surface of the ilium is known as the iliac fossa, and right at the top of the hip bones is the iliac crest. This is the ridge at the top of the ilium where large muscles attach. If you place your hands on your hips, they sit right on top of the iliac crest. The crest ends anteriorly as the anterior superior iliac spine. Unlike the pectoral girdle, the pelvic girdle has a very deep acetabulum, or socket, that is cup-like. Thick and strong ligaments help to firmly secure the head of the femur in place at the hip joint. Thus, the hip joint is designed more for stability rather than mobility. The coxal bones are joined anteriorly by the cartilaginous joint called the pubic symphysis. The pubic bone is found slightly more anterior, lying nearly horizontal. The two pubic bones join anteriorly at the pubic symphysis and create the inverted V-shaped arch, the pubic arch. The angle of this arch helps differentiate if the pelvis belongs to a male or a female skeleton. The pelvic inlet is found along the line of the pelvic brim, and the pelvic outlet is created by the space between the ischial spines. The lateral and medial views of the pelvis are often quite tricky to navigate. In the lateral view, we can see the large wing of the ilium bone, or the ala. The posterior surface of the ilium is the site of attachment of the big gluteal muscles, our buttock muscles. The posterior superior iliac spine is relatively easy to find as a superficial landmark on many people. This is where we see the dimples on our lower back. On the ischial bone, we find the greater sciatic notch, which allows the sciatic nerve to pass. The obturator foramen, a large opening in the hip bone for nerves and blood vessels to pass through, is nearly closed over by a fibrous membrane in a living human. And the acetabulum, the hip socket, can be viewed better from this aspect. Even trickier is recognizing these bony features on a skeleton without color. It is important to get used to viewing different aspects of each bone in the skeleton, as well as different types of models in preparation for your laboratory sessions. Try to label the specific features we have just covered and refer to your atlas for confirmation. Let's take a look at the difference between the male and the female pelvis, and the clues that can guide us to know whether a pelvis belongs to a male skeleton or a female skeleton. First of all, can we even tell which view of the pelvis we're looking at? The top two pelves is the plural of pelvis, are viewed from the posterior inferior direction, that is, from slightly behind and underneath. The bottom two pelves are viewed from the anterior direction. So which pelves are male and which ones are female? The two pelves on the left-hand side of the picture belong to a male skeleton. The two pelves on the right-hand side of the picture belong to a female skeleton. So how do we tell the gender differences in the skeleton? One of the first things to look for is the angle of the pubic arch, which is best seen from an anterior view. Secondly, look for the size of the bones. And thirdly, we're going to observe the shape of the pelvic inlet and outlet. The male skeleton is adapted for the support of the male's heavier build and the stronger, larger muscles. Therefore, the bones are usually heavier and thicker. The acetabula are larger and closer together, and the cavity of the true pelvis is narrow and deep. The angle of the pubic arch is quite acute, about 50 to 60 degrees. It has a narrow and long sacrum, and the coccyx curves ventrally or anteriorly. The pelvic inlet is heart-shaped and narrow, and the ischial spines are long and sharp. The female pelvis is adapted for childbirthing. The true pelvis defines the birth canal. The true pelvic cavity is broad and shallow, and the bones are thinner and lighter. The acetabulum is smaller and further apart. The pubic arch sits at a more obtuse angle, about 80 to 90 degrees. The sacrum is short and wide, and the coccyx is more mobile to allow flexibility during the birthing process. The ischial spines are shorter and further apart to allow a larger pelvic outlet for easier delivery during birth. Additionally, the pelvic inlet is wider and more oval in shape, side to side. Distal to the pelvis we find the femur, the largest and strongest bone in the body. The large head of the femur is almost a whole sphere, and it articulates with the hip bone via the acetabulum. The hip joint is very deep and stable, with the head of the femur held securely in place by thick, strong ligaments. The stability of the hip joint sacrifices mobility, so structure suits its function. The femur has a short, constricted neck, and the neck of the femur is a common fracture site seen in the elderly population. The greater trochanter, the lesser trochanter, the gluteal tuberosity, and the linea aspera are all attachments for large muscles of the buttocks and thighs. The lateral and medial epicondyles are our attachment points for the ligaments that transverse the knee joint. Distally, the femur terminates in the lateral and medial condyles, which articulate with the tibia at the knee joint. The anterior view shows the patellar surface, where the patella, or kneecap, is located. Let's try and label some of the features of the femur in the images. Remember, you can pause the presentation if you need extra time. The left image shows the femur in the anterior view, and the right image shows the femur from the posterior aspect. First, find the head of the femur. Neck of the femur. Greater trochanter. Lesser trochanter. gluteal tuberosity, linea aspera, lateral epicondyle, medial epicondyle, lateral condyle, and medial condyle. As we continue to travel distally along our appendicular skeleton, inferior to the femur, we find the tibia and fibula. The tibia is the weight-bearing bone of the lower leg. It is much larger of the two bones in the lower leg segment. The tibial plateau is found at the proximal end of the tibia, at the articular surface of the knee joint. The tibial tuberosity is the prominence where the thick patellar ligament attaches the quadriceps muscles via the patellar tendon to the tibia. The medial and lateral condyles, remember condyles form joints, receive the distal femur to form the knee joint. Distally on the tibia, the medial malleolus forms a bulge at the ankle. The fibula is the thinner and lighter bone in the lower leg. It lies parallel and lateral to the tibia. It doesn't actually articulate with the knee joint proper. However, proximally, the head of the fibula does articulate with the tibia. It has a long shaft that terminates distally in the lateral malleolus. In the lower limb, we also see an interosseous membrane made of fibrous connective tissue, similar to that found in the forearm between the radius and the ulna. But in the lower limb, it secures the fibula to the tibia. Which bone are we observing on the left-hand side of the screen? And, in particular, which aspect are we viewing from? Features on the tibia that are highlighted are tibial plateau, lateral condyle, tibial tuberosity, medial malleolus. The bone on the right-hand side of the screen is observed from the lateral view. This is the fibula. The highlighted features include the head of the fibula and the lateral malleolus. Great job! At the very distal end of the lower limb of the appendicular skeleton, we find the foot and ankle. The ankle is formed by the tarsal bones. We are particularly interested in two of these tarsal bones, the talus and the calcaneus. There are several different tarsal bones, however, we will only focus on these two. Firstly, the talus is the one the tibia articulates with. Tibia on top of talus. Remember that. Tibia on top of talus. The talus also articulates with the calcaneus, which is the heel bone. The metatarsals provide the midfoot region, the length, and the arch. And the phalanges form the shape of our toes, like they do the fingers in the hands. However, in the foot, there are 3 phalanges for each of the toes. Keep in mind we have tarsals and metatarsals in the feet, but we have carpals and metacarpals in the hand. It may be a handy hint for remembering T is to do with the toes. It might help to think of the tibia on the tarsals on the metatarsals, and the metatarsals on the toes, or phalanges. We are now ready to review the appendicular skeleton Concepts, Part 2. The lower limb articulates with the axial skeleton via the pelvic girdle. The coxal bones articulate with the axial skeleton via the sacroiliac joint. The coxal bones are comprised of three fused bones, the ilium, the ischium, and the pubis. The head of the femur articulates with the acetabulum. The lower leg is comprised of the tibia and fibula. The tibia articulates with the second largest tarsal bone, which is the talus. The metatarsals form the forefoot. The phalanges form the toes. That brings us to the end of Module 1, Topic 1.3, the appendicular skeleton. You can see here that we have completed all of our learning outcomes for Topic 1.3, Part B, the pelvic girdle, and the lower limb. We have described the composition of the pelvic girdle and its attachment to the axial skeleton. We've identified the structural features of the coxal bones. We've identified the structural features of the femur. We have identified the structural features of the tibia. We have identified the structural features of the fibula. We've identified the key tarsal bones in the foot. And we have identified the phalanges in the foot. Here are several review questions that you might like to think about before you come to the tutorial session. How does the scapula attach to the axial skeleton? Where does the pectoral girdle articulate with the axial skeleton? What structure unites the coxal bones anteriorly? Which bone in the lower leg is the weight-bearing bone? What is the purpose of the patella? Try and answer each of these questions before the tutorial session, and we will discuss them further.